pediatric and burn. Children is our core of interest because they are our future generation, and by taking care of the children, they need a special kind of care because of their emotional support, and for the taking care of the children, you are taking care for the whole family as well. And why children and burn? Because children are more probable for different kind of burn than adults. So we have to look at this kind of burn and management from many different aspects and angles. This kind of different kind of burns, as chemical burns, is very attractive to the kids, and they can get to it, reach to it by their the initiation of discovering the stuff, and it can end up with this kind of special in the shape, like this kind in this picture. Electric burn, usually it's happening, patient discovered the holes in the outlet by the ironing like keys and end up with a severe kind of burns. Liquid burn, this is a very typical scenario. The patient, the child tried to approach the cup in the desk or in the bench, and it ends up with this one side burn in the body. If the child is right-handed, usually end up with the right side, and if it's left-handed, end up with the left side. Iron burn, in seconds, the mother pick up the phone and end up with a burn. Fire burn with different type, matches, lighters, fireworks, and camping can end up with a disastrous burn and severe burn as in this case. So, but it's not that's it. We are not treating only physically, because this kind of traumatic illness can lead up to another kind of impact with a different type of psychological impact which can affect the children and can last long with in adulthood. Fear and anxiety from separations, nightmares, bedwetting, teasing by other children, which make them decrease their self-esteem, isolation, anger and agitation, aggressive behavior, especially in boys, decreased school performance, depression, especially in girls. Sometimes it ends up with different somatic disorder, like organic symptoms. The child came up with different symptoms of stomach ache, headache frequently, and all investigations done, but the underneath is the psychological trauma which the kid get from when he was a victim of burn. Drug addiction also is the influence can happen later on when the kids get older. So, sharing of management is the core of interest in kind of burn, especially with children's, because from the burn unit we have to detect it earlier and to act it earlier. With the sharing of management with psychotherapists, psychologists, it's very important to get the satisfaction of the patient and their families. And not only in kids, there are many adult patients, they came up with dissatisfaction after the surgery happened or cosmetic procedures. That's why, because they have a psychological impact in themselves, in hesitation of the body image, and they are demanding and ordering for frequent operation. And however, the operation is beautiful, but the patient he's affected psychologically from inside, and he have to deal with it. So he keep on going from other doctor to other doctor, not satisfied, and the problem is not about what the procedure, the problem from inside. So it's really connected to each other, psychological aspect with the cosmetic and plastic surgery. And here a graph which showing that really in the plastic surgery, it really affecting mental health, especially in body dysmorphism and depression. It's improving the mental health for them. So rule one in prevention and the management is the prevention for avoiding this stuff from the kids to reach and to be under supervision and the special care. And you have to detect also child abuse. Many kind of burn is purpose of child abuse. So, second management is the burn center. With a good care in the burn center, we get a better scar to deal with. Plastic surgery, like in this lady, she's got an oil burn in her left side of the face, and she has a very beautiful outcome after the surgery, but she's not still satisfied because her psychological impact inside. So we have to help children to cope with this social anxiety and stigmatism, promote development of positive self-image, initiate interest and strengths to overcome the impact, providing a clear plan for reconstruction and rehabilitation, assess patient and family expectation, and assist them to communicate with burn team. In conclusion, this body dysmorphism and this disfigurement, this is a rule. This is a normal way feeling of patient after this kind of crisis, like a burn. And psychotherapists, psychologists, is an important management to interfere to get a better rehabilitation and reconstruction of these families and these children. So the holistic approach in a biopsychosocial way is very important to get a better quality of life for this kind of burn injuries. Thank you.
Thank you, doctor, for your presentation. From Omnix International, your certification for your presentation. Thank you very much. Can you remain here? Okay, now
you can make it with 3 methods. First, you can use botulinum. Second, you can use fillers. And third, you can use endopil. I will speak it later. And there is a surgical. So, of course, with surgery, you can correct any kind of deformity. You have no limits, and even you can make secondary, tertiary rhinoplasty. But with medical rhinoplasty, you have some limits. Of course, you cannot correct any deviated nose or things like that, or a nose which has been treated before by surgery. But I would say that, for example, medical rhinoplasty can be reserved mostly also to some plastic surgeons who don't make nose each day. That can be a good point. And second, to patients who don't know exactly what they want, who are difficult. If you take something not permanent, because at least they cannot make a lawsuit against you. Of course, if you inject in a vascular vessel the fillers, then you will get necrosis and it will be the worst. That's my opinion.
okay, thank you very much.
You're welcome.
And now we have the presentation of Dr. Marcio from Brazil. Very interesting presentation. And there are any questions for Dr. Marcio? I remember that is facelifting is combination with resurfacing CO2. You use it. Okay, I make a question. And so, in your experience, did you have any complication after this combination, resurfacing and facelifting? Which that you worry very is...
Yes. The most important complication, the major complication is hematoma. But hematoma is a complication that may occur in our facelifting. Not increase the rate if you use laser application and this as an ancillary procedure. I want to say that if you take care, if you made a pre-operative cares, you select your patient. I used to not to do laser on type 5 and type 6 of Fitzpatrick. I do only 1, 2, 3, and some of type 4 skin. But if you prepare the skin before and you take care of the skin after the procedure, you don't have higher incidence of complications combining the laser application. It's important to say that the high energy of the laser are done on a non-undermining skin. The undermining skin, you use a low energy of laser, and it's a way to prevent complications. Finally, I want to say that the complications I had about 1% of minor, of 1% of major complications. Only partial necrosis, just one case in 80 researched, and hematoma, 5 cases of 5%. It's the same of the international literature, not higher than.
Okay, thank you very much for answer. Okay, now we have the presentation of Dr. Hefner. Yeah. Yes, and there is any question for Dr. Hefner?
For me, how many years do I perform? Or, well, endoscopic operation I don't. How long? It's after 6 months. After 6 months, it's not longer. The controls. Yes, I should see them. But I don't get them all, and I haven't a large patient collective. I have a small practice and have not a large amount of patients. You know.
Yes, please.
Why do we have? Also, no. So you have seen the technique. You have a mixed technique. You should prepare also with your hands, not only with instruments. You should not the sutures with your hands. You have seen. So I push my finger from the temple onto the zygomatic arch and put my knot. So I use my finger. Naturally, there are other ways of endoscopic surgery. There are other instruments. You can use much more minimal scars, but it's not the goal of the operation. The goal of the operation is the perfect lifting of the face, the secure lifting with longevity. So, the security, you should do all steps to reach that. It's not the only goal, the small scar. If the scar 4 centimeter or 6 centimeter is equal when the scar good heals and covered with the hair. The most important thing there's you get no hair loss. So you have make a thick flap without damaging the hairs. If you have a thick flap, you have a good blood supply, and you get a very good wound healing without any problem.
Okay, thank you, Dr. Hefner. There are the next presentation of Dr. Samman. Do you have any question?
I had a question to Dr. Moreira.
Dr. Moreira.
I realize you make a lateral orbital myotomy. I have read this first presentation, Alain Fogli from France. Fogli made this myotomy against folds, smiling folds. So how do you perform it? What part of lateral, what part of the orbicularis do you dissect?
I take off a very small slice of the orbicular, very small and very superficial, to avoid lesion of the facial nerve when I'm doing the lifting. And to fix it, when I'm doing the blepharoplasty, I only do the cantopexy if there is any laxity of the eyelid. I don't do the cantopexy in all the case, but it's a small stitch here, and very easy to do. It's okay.
Okay, thank you for your answer. Okay, and for my presentation, you have any questions here? Okay, the session is, we have the lunch time. We come back here at 2 p.m. here. And we have another workshop for presentations, and so we wait here in 30 minutes. Okay, thank you very much. 1:45. 1:40. And so we have 30. Okay, we have only 15 minutes. Okay.